So we really have to treat this disease as a whole. This is a systemic disease. Even though I work in cardiology, we are very commonly the quarterbacks of the team. We help to coordinate a lot of the care between neurology, between immunology, gastroenterology, nephrology, pulmonology. There are so many healthcare clinicians that are involved in the treatment of this disease. And we really look to the patient to see what works best with their lifestyle. If it is something that they live very rurally and they're not able to get to an infusion center to do an infusion or to have an injection and they can't get to the doctor's office, we may consider an oral medication. So a lot of it just depends on their current treatment, what they're taking for their heart failure symptoms, and if that works best with their lifestyle.
Indication and important safety information. Indication. Attruby acoramidis is indicated for the treatment of the cardiomyopathy of wild-type or variant transthyretin-mediated amyloidosis, ATTR-CM, in adults to reduce cardiovascular death and cardiovascular-related hospitalization. Important safety information. Adverse reactions. Diarrhea 11.6% versus 7.6%, and upper abdominal pain 5.5% versus 1.4% were reported in patients treated with Attruby versus placebo, respectively. The majority of these adverse reactions were mild and resolved without drug discontinuation. Discontinuation rates due to adverse events were similar between patients treated with Attruby versus placebo, 9.3% and 8.5%, respectively. Laboratory tests. Mean increase in serum creatinine of 0.2 and 0.0 milligrams per deciliter, and a mean decrease in eGFR of 8.2 and 0.7 milliliters per minute per 1.73 square meters was observed in the adults with ATTR-CM treated with Attruby versus placebo, respectively, at day 28 and then stabilized. These changes were reversible after treatment discontinuation. Use in specific populations. Pregnancy and lactation. There are no data on the use of Attruby in pregnant women. Animal data have not shown developmental risk associated with the use of Attruby in pregnancy. There are no available data on the presence of Attruby in either human or animal milk, or the effects of the drug on the breastfed infant or maternal milk production. Please see full prescribing information for Attruby at attruby.com/PI.